How are you getting the word out, first of all, that there even is a special election in that district with the voters so distracted by everything else? And how do you get voter turnout in what is basically a mail-in election?
Oh, thank you for that question. Thanks for having me on, Lawrence. You know, we've used a lot of the traditional campaign methods. So, of course, we're sending out mail. We've got a robust TV program running ads on cable as well as broadcast. And we are doing a lot of work by telephone. We have the benefit of hundreds of volunteers from Brooklyn to the Bay Area in San Francisco dialing in for us every single day, reaching out to our voters, letting them know that this election is happening, that it's important, that they need to get those ballots in by mail or avail themselves of one of several voting centers that will be actually available on Election Day on Tuesday.
I actually want to keep the map of your congressional district up there because I want this to be a public service announcement for the voters who live there, that they do have this coming up on Tuesday. And they've all received ballots in the mail, so they could all vote tonight. They could all vote by mail this weekend, Monday, Tuesday. What are you finding, or were you finding, is the number one issue? It was health care when the last congressional campaign was run in that district.
Yeah. No, it's absolutely still healthcare for a lot of people, especially people who are concerned about this virus in this moment. But as our volunteers are making calls and as we're reaching out, we're really finding the significant ways that people were immediately impacted by this crisis. You know, we've seen large numbers of folks become unemployed in very short order across this district. We have people now struggling to make rent, to be able to buy groceries. You know, it's hard to think about participating in an election in a moment like this where you're really thinking about how you're going to make that next trip to the grocery store and cover that bill. So we're being sensitive to that. You know, the benefit, again, of all of these amazing volunteers. They're also using this as a moment to reach out and see how we can help and be of service to people who desperately need it.
The healthcare had a certain resonance in 2018 in the campaign. Now it seems to be a different issue within the world of coronavirus. So many people have lost their jobs. The unemployment that has definitely hit your district in a big way. And that will also add to the healthcare crisis because people will be losing healthcare that they had obtained through their employer.
Absolutely. And, you know, I'm so proud that here in California, with Covered California, we've extended that enrollment period through June 30th. So we want California residents to still be able to get on some kind of plan if they can afford it. And if their economic circumstances have changed, we certainly want to help them qualify for Medi-Cal benefits so that they're not going without that important coverage. But, you know, this has been a persistent issue in this country for decades, not only access to care because of a lack of coverage through insurance plans, but now, as we're seeing in some of these states like Georgia, where we were just talking about, you know, you've got entire counties in some instances where you don't have a hospital system with enough ICU beds. You've got rural communities and even some urban communities in this country where people don't have access to a medical provider, even sometimes by telehealth. So there is so much more that we need to be doing to keep Americans healthy, especially on the other side of this crisis, with so many people who will have been exposed. And this now becomes a pre-existing condition for them.